is Brandie Thomas. I'm performing my head-to-toe physical assessment for my advanced health and physical assessment class at South University. Prior to me coming into the room with the patient, I washed my hands with warm soap and water at the zinc, which is on the outside of the room. I don't have a zinc and paper towels in here, so I did that prior to coming in, which is in the next room over, but I am going to use an antibacterial as far as hand sanitizer. Hi, my name is Brandie Thomas. I'm one of the nurse practitioner students at South University, and I'll be working with you today. What brings you into the office today, sir?
Doing physical for work.
Okay, and can you tell me your name and date of birth?
Jacoby Jacobs, 07-16-91.
Okay. Alrighty, and I just have to go through and ask you as far as a couple of questions. Can you tell me what today is?
June the 12th of 2019.
Okay. And can you tell me what day of the week it is?
Wednesday.
Okay. And who is the President of the United States?
Donald Trump.
Okay. And what month is it?
June.
Okay. And those questions I went through to ask you just as far as to check your memory and your cognition, just to see if you were alert and oriented. Now, as far as we collected, prior to you coming back to the exam room, we collected your vital signs. Now, as far as your attire you have on here, which with the patients coming into the office, they may wear street clothes, but then they change into something more comfortable if they prefer not to wear a gown, which he has on a loose t-shirt and a pair of basketball shorts, which are more comfortable for the men as opposed to the hospital gown, so that is why he has that on, and easily shoes to slide off, which are Crocs. Now, as far as your vital signs, our medical office assistant and the nurse, they greeted you prior to you coming back here. The vital signs I have for you, your blood pressure was 128/70, which is fairly good. Your heart rate is 78, respiratory rate 20, temp 98.1. Your oxygen saturation is 99%, which is good. Normal is in the lower 90s up to 100. Now, as far as your weight was 250 and your height was 5'8", that puts your BMI, which is your body mass index, at 38. And with that number, the normal BMI for a male of your age, they prefer for it to be 18.5 to 25. And when you get to 27.8, that is considered overweight. The 38 where you're at, they would consider that to be obese, which they base that on your height and how much you weigh, and that's how they calculate that. But as far as prior to that, as far as, do you take any medications on a daily basis?
No.
Do you have any medical problems?
No.
Are you allergic to any medicines?
No.
Okay. Have you ever had any surgeries?
Just wisdom teeth.
Okay. That's wisdom teeth removal. How many teeth was that total?
3.
Okay. And when did you have that done?
Last month.
Okay. It was May. Was it towards the end of the month? Do you remember the exact date or a day around that date?
May the 22nd.
Okay, May the 22nd. Okay. All right. Now, as far as what I'm checking now is just, without me even touching you, is just looking at your general appearance, the general tone of your skin, just noting if you have any marks, scars, or bruises anywhere on your extremities, anywhere on your face, any skin color discoloration. In patients with skin disorders, you can notice the discoloration in their skin. If they have disorders where their skin is excessively dry, or if you have the discoloration where you have sometimes blotches, different colors of the skin present. As far as what I'm going to do now, I'm just going to inspect your scalp. Now, do you have, which I'm just filling in here, do you have any problems as far as like with any itching of the scalp, any excessive dryness? I'm going to have you just bend a little for me forward.
No.
Okay. And we'll just check for any lesions, any redness, none noted here. And then I'm going to have you just lean up for me for a second. And I'm going to have you look at me and clench your teeth like that, okay? And I'm gonna have you smile, frown, okay? Puff out your cheeks like real big, okay? I'm going to have you squint your eyes and kind of close them kind of tight, okay? With checking those features as far as with his face, you go through and check as far as your cranial nerves just to make sure those are intact and no problems with that. Now I'm going to feel your joints here. If you can open your mouth and then close for me, okay? Okay. Now, do you use any type of corrective lenses, glasses, or contacts?
No.
Okay. When was your last eye exam? Do you have a routine eye exam? Okay. When was the last time you had your eyes examined?
I can't recall.
Okay. I'm going to have you look straight ahead for me. I'm just going to flash just in your eye for a second. And I'm just checking to see if his perla is intact and how responsive his eyes are to the light and accommodation. And you'll notice as far as the constriction of his pupil and then the relaxation of it when the light is removed from his eye or from his vision sight. Okay, I'm going to have you also kind of raise your eyebrows like you're, okay, just like that, like you're kind of surprised. Now I do not have the as you would say, as far as the ophthalmoscope, as far as to look directly into the light. So I'm going to improvise with the tool I have here. This is the same device I'm going to look into the ears with. I'm just going to improvise and act as if it is the ophthalmoscope. Let me just look straight ahead for me. And if I would have that, I could see directly behind the eye as far as like any deformities with the eye. And I'm going to have you just look straight ahead. Just look straight ahead, don't look at the light. And now I'm just checking to see if the light does reflect off of his eyes as well. Okay. And I'm going to have you to follow my hand with your eyes. Do not move your head, just move your eyes, okay? And that's just following as far as to make sure his eyes can follow the direction of my hand. Now we're going to do a visual test using the Snell eye chart. It's going to check as far as your visual acuity. I have to go grab one thing, but while I go grab that, I'm going to have you stand right here, sir, at this marker here. Have you stand right there for me. Go grab one more thing. I just remembered I had to grab a pair of gloves for when we get to the oral section as far as of the assessment. Okay. And I printed off an eye test chart. It's not the actual size, but it has the letters and number, and we're just going to accommodate as best as we can. Now we're going to try this with both of your eyes open where you can see. If you can tell me the letter here.
E, F, P, T, O, Z, L, P, E, D.
Okay.
F. Drop your pen down a little bit. D, C, F, D.
Okay.
I can't make them out.
Okay. I'm going to have you cover your right eye. with your hand. Okay.
E, F, P, T, O, Z, L, F, E, D.
Okay.
I can't make out then.
Okay. Now we're going to do your left. And with the left, we're going to read, instead of reading it left to right, we're going to read the opposite direction.
E, P, F, Z, 0, T. I can't make it out.
Okay. All right. And typically, you can have a seat right here, sir. And typically, he would be able to see this better. Normally, as far as like the patient's vision, according to his past medical records, he had a vision test years ago, and it was around 20/20. But this vision test is not as to size, so he probably would be around 20. He would be around the 20/25 area, all the way around for both eyes and then individually covered. So we're going to rate it as that. Just a rough estimation because that chart is not actual to size, and I don't have an actual selling as far as like eye vision chart. So we'll just note that. As far as any pain with your eyes when you were doing as far as vision tests? Okay. Now, as far as, and when earlier we looked into the eyes, I used the other device because I didn't have the actual device that you look into the eyes with, but I didn't note anything. Now, if you had a horrible time reading the chart, we would refer you as far as to an eye specialist if your vision was not up to par as far as within normal limits. I'm going to do a couple of tests with you. If I can have you just to close your eyes for a moment, please. And this test is going to, as far as check for his sensitivity, and you're going to feel something brush across your face. I want you to tell me if the object is soft or pointy.
Soft.
Okay, we'll do the other side.
Soft.
Okay, now we're going to do a smelling test. Just keep your eyes closed. And this is testing your olfactory nerve. What does that smell like?
Pain and flush.
Okay, and that is correct. Okay. Alrighty, sir. I'm going to have you just to tilt your head back for a second here. Tilt back a little more. I'm just looking in your nasal cavity. And with this, you want to make sure the nasal airway as far as clear. You don't see no sign of irritation. As far as the septum, no deviated septum. Sometimes you can see it as far as deviated if the patient has a history of nose injuries that did not heal correctly. And if the patient also has chronic, if their nasal airway is very dry, you will notice the dryness in there. If they have excessive runny nose or rhinorrhea, you will notice as far as the drainage. Do you have as far as any problems as far as with your allergies or sinuses? No? Okay. Now, any pressure as far as in this area? And what we're checking as far as the sinus cavities in here, this is your maxillary, and then we're going to check up in this area. Sometimes patients with sinus problems can have pressure along in this area, and basically at times it can feel like it radiates back into the ears as well. Do you ever have any headaches?
No.
No. Okay. Going to take a look on the inside of your mouth, sir. If you can say ah for me, kind of big. You can say ah, stick out your tongue. Okay. Okay. I'm going to look at your teeth here. We're just using, as far as this is like a little, as far as a mirror to look and inspect. So looking at the top of your palate here. You want to check and make sure as far as like no dental problems. You want to check to see where you had the wisdom teeth removed, and that area has healed up nicely. I don't see any other cavities. Can you say ah? Stick your tongue out real big and just go ah real big. You're gonna feel this one in the back of your throat. Say ah. Say ah. I'm just using this to push your tongue down. Okay. And we're looking as far as at the area back at the tonsils, just to make sure you have no swelling, inflammation, no redness. If he was positive to have as far as sore throat or may have been infected with strep throat, you will sometimes see the white patches to the area of the tonsils. And he has no excredate present anywhere in his mouth. As far as your dental care, prior to getting your wisdom teeth pulled out, how often would you say you went to the dentist?
About every 10 years.
Okay. Now, since having those removed, do they have you following up more frequently now?
Yes.
Okay. So, and that's good. That's as far as health promotion, being proactive in your health by having routine dental screenings as well. I'm going to have you stick out your tongue for me, and I'm just going to look as far as for the symmetry of your tongue. If you can say ah and kind of just stick it out for me. Okay. And as far as that's just also checking as far as to make sure everything is equal and in line as well. Now we're going to move along as far as further down to your neck area. I want you to sit up straight for me if you can. Shrug your shoulders for me. Okay. Now I want you to push up against my arm. Okay. Now bear, kind of try and keep your arms down as far as, or bring your arms down like that. Okay. All right. I'm going to have you raise your arms up above your head for me. Okay. All right. And then we're going to bring them out like this. And we're going to go reverse as far as like in a circle. I'm going to have you stand up to do that as well. Stand as far as reverse in a circle. Okay. And now we're going to go the other direction. Okay. And bring them out to the front. Now we're going to go like this. Okay. Now we're going to bring them to your side. Bring up. And bring like this. Okay. And bring out. Okay. All right. And that is just checking as far as for his overall range of motion in his shoulder joint and as far as in his shoulders as well. And with that, you want to just make sure you have no deformities there. Some patients, if they have an injury to their shoulder, they may be limited as far as like in their mobility that they have with that. So, have you ever had any injuries to your shoulder, neck area, upper back?
No.
Okay. Now I'm just going to palpate your lymph nodes in here. And I'm going to indicate your arm. Do you ever have have any pain or swelling, tenderness under your arm? Because you have lymph nodes through your lymphatic system as far as throughout your body. And with your neck, I want you to do as far as just bend down like this, and we're going to bring it all the way back like that, and go around kind of in a circular motion to the front, and then going to back, and we're going to go the opposite direction. Okay, thank you, sir. And you said as far as like no injury, as far as with, okay. We've already checked your range of motion. I'm just going to take a moment and look at your back area here. And I'm just looking at your shoulder blades, making sure as far as it's symmetrical. And while I'm here on your back side, I'm going to go ahead and listen to your lungs. Take a deep breath for me. Okay. And I'm going to have you as far as just to bend over in front of me and touch your toes. I'm going to just slide this shirt here a little bit. I'm going to look at your back area. Just as far as like as your spine. Okay, you can stand up. Okay, sir. I'm going to have you, you can have a seat right here. As far as, do you smoke? Any history of smoking? No, you said you don't smoke, no history of smoking. Let's continue here. Take a deep breath for me. Deep breath. Okay, I want you just to relax. Just relax. This is just going to check as far as for your reflex. Okay. Just relax. Okay. If you can take and squeeze my hand, pull me towards you. Okay, push me away. Okay. And let me see your hands. Okay, push up against my hand. Okay. Push down on my hand. Okay. Now, leave your hands like that. Push up against my hand. Okay. Now I'm going to push down. Okay. Now, I'm using this. I do not have a tuning fork, so I'm using this in the place of one. We're going to check as far as with your hearing, the Rhine and then also the Weber test. And as far as for my otoscope to look in the ears, I have this one. I don't have my actual own, so I'm using this as a supplemental device here. So, what I want you to do, as far as I'm going to place this on the center of your head, and tell me, I'm going to have you sit up straight, and tell me where you hear the sound more, or if it's equal in both ears.
Equal both ears.
Okay. Okay. Now we're going to do both ears here. It may be as far as here at your ear, like on the outside, and then you'll feel this here. So let me know when you hear the sound, okay?
I hear it.
Okay. Okay, I'm going to take a look at your ears here. Okay, eardrum is visible, no expiry date noted, no earwax, ear is clear, no redness noting, no irritation. Okay, this ear as well, no expiry date noted, eardrum is visible, no redness, and no earwax present. Okay. What type of work do you do, sir?
Diesel technician.
Okay. Now, with that, do you ever have any heavy, loud equipment as far as drills or?
Yes.
Okay. Do you wear as far as protective ear plugs there?
Yes.
Okay, you use earmuffs. Okay. Okay, and that's also being proactive in your health as well by using the earmuffs as far as to cover your ear and protect your hearing. Because you're fairly young and you want to make sure you're doing proactive steps to safeguard your health because you have a long life ahead of you. So. Okay. Going to this shirt here. I'm going to have you lay. I'm going to listen to you right before you lay down. To you here. And we're just going to listen as far as to all his different areas of the heart. Okay. Alright, sir. I'm going to have you lay back here on this area. And as far as with his heart, the areas I listened to was his aortic, pulmonic, and then also as far as with his different areas, he had normal heart rate and rhythm. And also with his aortic, pulmonic, pulmonary and tricuspid and mitral valves, there was no, as far as regurgitation, everything was flowing as normal, no heart murmurs present. And with his shirt here, it's more of a thinner shirt. So I'm just going to check as far as the chest here. I'm just jotting short notes as far as of my findings and on the assessment. Okay, slide this shirt up here. Going to look at your stomach here, sir. Do you have as far as any abdominal pain?
No.
And here we just inspect, make sure as far as everything is symmetric, no bloating, no abnormalities. He has some hair distribution, which is normal in men. There is some striae, which is present on the outer parts of his abdomen, but no rashes intact. There's 2 small bumps there, but other than that, no skin abnormalities there. Okay, and your vital signs are active. When was, you can leave, just leave your shirt, I gotta do some more stuff with your stomach. When was your last bowel movement?
About 2 hours ago.
And right now, as far as I'm just percussing, as far as his organs here. Okay. I feel no abnormalities as far as with his stomach. Sometimes in severe cases, as far as patients with severe constipation, they may have as far as the abdominal bloating. Sometimes you can feel as far as in the colon if it's very severe. Now, typically for you, do you normally go to the restroom every day, every other day? What would you say is normal for you?
Twice a day.
Twice a day? Okay. Now, as far as with, let's see, with, you said twice a day, do you have any severe gas?
No.
And I'm just going to go a little bit deeper. Sorry, I know this is a little uncomfortable. Patient here. As far as, and then I'm percussing as far as the areas of the liver and spleen. And you have appendix and gallbladder. And your liver and spleen, as far as sometimes, as far as if it is enlarged, it can be noticed on the left side, but I see no abnormalities there. As far as with deep palpation, you can feel that. And sometimes on patients that have more of the adipose tissue, you may have to palpate a little deeper to feel as far as palpate that as well. Now, as far as with your urinary, any problems as far as with peeing, any difficulty peeing, any pain when you urinate? Okay. And let's see. Also going to check something as far as why I have you laying here. If you'll uncross your legs for me. I'm going to put my hand here, but I want your leg, relax your leg for me. I want your leg to go against my hand. Push your leg against my hand. Try and bring this leg up. Okay. And I want you to lay on your left side. If you'll lay like that for me. Okay. And I'm going to extend as far as bend this leg here. Any pain?
No.
Any pain?
No.
Okay, you can lay back on your back. Just gonna palpate as far as sorry, I know you're ticklish. I'm just gonna palpate. See if that your bladder is not enlarged. Okay. Alrighty. I'm going to have you as far as stand up for me. And I'm gonna have you turn around. I'm just gonna slide your shirt up here. Can you see me good? Okay. Right now where I'm looking as far as just your hip area here, and it is level. I'm going to have you take your leg one at a time and do one like this, and do your other one. Okay, now we're going to bring your leg back. Just kick it back. Okay, kick your other one. Okay, now we're going to bring them straight up like you're marching. Okay, and now we're going to take your leg and we're going to go outward like that to the side. Okay. Okay. Alright. As far as, do you ever have as far as like any pain in your hip area?
No.
Any pains as far as like with your legs?
No.
No? Okay. Okay. Let's see. Any problems with your knees?
No.
Checking make sure as far as that's good blood flow. And pulses are palpable. Make sure this knee is swelling. And palpable. I'm going to have you to try and squat for me, then come back up. Okay, alright. And I'm going to have you have a seat here. And check the lower part as far as of your leg. Extend this leg out here for me. Just take it. I'm just going to inspect his feet. Check your pulses here. There. Bottom of your feet. Okay. Check here. Check here. And your discoloration. Now, as far as with the protective gear, as far as for your feet, are you required to wear a certain type of shoe at work? Or
Just a regular boot.
A boot? Okay, so you wear a boot. Now, do you wear good supporting shoes? What type of flooring are you walking on all day?
Concrete.
Okay. And about how many hours a day do you work?
10 hours.
As far as your pulse is good circulation, as far as with your popliteal pulse, and then as far as here, you have good circulation with your popliteal pulse, dorsalis pedis pulse. Good. And posterior tibia. Okay. No swelling. Noted. Do you ever have problems as far as with your feet or ankle swelling?
No.
Okay. And pulses are good on this side. I'm going to check your reflex. I do not have a reflex hammer. So I'm substituting it with another device. I'm going to use the corner of this object here. Just relax your leg. I'm going to have you sit back in the chair some more. And just relax your leg. Now, you may feel a distinct jerk. Just try to relax, okay? Okay, just relax. Okay. Reflexes are intact. Now we're going to do as far as some exercises involving your upper extremities and also your lower extremities. Earlier we had you to squat. Right now I'm going to have you to stand. Just slide your shoes out of the way for a second here. And I'm going to have you come this way for me. Have you turn around. And I'm going to have you walk just forward and come back and turn around and walk how you normally walk. Then when you turn around, I'm going to have you walk heel to toe. And this is just testing your coordination. Okay. Now, have you ever had to been hospitalized for any muscle injuries, any broken bones, nothing like that? Okay. Any car accidents? No. No? Okay. Okay. I'm going to have you do your arms like this. Okay. And we're going to bring one out, in, out, in. We're going to do it simultaneously. And again. Okay. Okay. And hands up. Up. Then down to your side. Going out. Okay. Okay. And down by your side. Okay. I'm going to have you to also put your arms straight out like this. And right directly in front of you. Put them as straight as you can. And I want you to close your eyes for me for a second. Okay. And this is just checking to make sure as far as he does not have as far as like any shifting of balance when his eyes are closed or any drifting. Sometimes you may see one arm wanting to drift down or to the side, but his are all straight out and even. It's okay. All right, you're good to go, sir. Let's see. Do you have any questions so far?
No.
No? Okay. Okay. And we're going to do another exercise as well. You're going to take your finger, put it on your nose, and you're going to touch my finger. Then go back to your nose. Okay, come back. Go to my finger again. Okay. 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 All right. Thank you, sir. All righty. And if you can have a seat right here for me. One last test that we're going to do is a whisper test. As far as part of your hearing, they did a standard as far as hearing test with a machine prior to you coming back here to me, and you did pass it, which it basically sends so many sound waves through your ear and then it's either rise, pass, or fail. But we also have to do a whisper test. So I'm going to have you stand here and you're going to face there. And I'm going to whisper 4 numbers, and you have to tell me the 4 numbers, 3 numbers. Tell me the 3 numbers.
6, 5, 4.
Okay. And we'll do it again. Okay.
7, 4, 5. 7, 3, 5.
Anything else? We can also, there is another test. We can, as far as with your involving your senses, I'm going to have you to close your eyes for a moment, And I'm going to give you an object to feel in your hand. And I'm going to have you to tell me what it is. Don't open your eyes, just grasp the object. And can you tell me what the object is?
A little toy car.
A car. Alright. Okay. And I'm going to have you keep your eyes closed for a moment. And I'm just going to rub something across your arm. And I want you to tell me if the sensation is sharp or dull, which dull means flat, soft feeling.
Flat.
Okay.
Sharp.
Okay. And what I did, as far as it was the soft end of my scissors, I did that on one side, and then the other side was the actual sharp piece, but it wasn't to the point where it would like cut him. It wasn't the blade part, so. And that's just testing as far as your sense of feel as well. Alrighty, sir. Everything looks good. Do you have any questions?
No.
Okay. Alrighty. Oh, there's one other reflex. If you can lay for me, I'm gonna check it as far as with your feet. And that should be the last one. As far as with your knees, elbows, and as far as with your reflexes going up this way, those were good. I'm gonna have you close your eyes for me for a second. Tell me soft or hard?
Soft.
Okay.
Soft.
Okay. Hard, sharp.
Sharp.
Alrighty, sir. Well, that concludes everything. I appreciate you for coming into our office today, and we will have your physical paperwork done. I just have to sign this off right here. Everything looks good. Alright, I will give that to you, sir. If they have any questions, you can just have them to give us a call here at the office. And on the very last page, I have we have a stamp of our address, telephone number, fax number, and my signature is there. Any information that they need, they will have that for you. And you can just slip on your shoes, and you're good to go. Just check out with the ladies up front.
All right. Appreciate it.